Question 1. A social worker is reviewing an involuntary client's records and notes that the client has a history of blaming all personal and professional failures on external circumstances, such as supervisors, family members, or the economy. This pattern of assigning responsibility to others for one's own unacceptable feelings or behaviors is best described by which defense mechanism?
A.
Rationalization.
B.
Sublimation.
C.
Projection.
D.
Intellectualization. Answer: C. Projection. This question tests the understanding of common defense mechanisms, and the key clue is the client's pattern of blaming all personal and professional failures on external circumstances. Projection is an immature defense mechanism where a person transfers their own unacceptable thoughts, feelings, or impulses onto someone else. The client is attributing their own failures, unacceptable feelings, to external sources such as their supervisor or the economy, rather than accepting them as their own. For example, a client who is cheating on their spouse might accuse their spouse of being unfaithful, thereby managing their guilt. Always remember that projection is fundamentally about attributing what is inside oneself to someone else outside. Question 2. A social worker is conducting an initial assessment with a 45-year-old client who has recently experienced the death of their parent. The client appears tearful, expresses feelings of deep sadness, and reports difficulty sleeping, but denies suicidal ideation. According to the DSM-5, what is the most appropriate initial understanding of the client's condition?
A.
Major depressive disorder.
B.
Persistent depressive disorder.
C.
Uncomplicated bereavement.
D.
Adjustment disorder with depressed mood. Answer: C. Uncomplicated bereavement. This question assesses the ability to differentiate between normal grief and a diagnosable mental disorder, with the keyword most, directing the selection to the standard presentation. Uncomplicated bereavement, or normal grief, is the standard and expected reaction to the loss of a loved one and involves symptoms like sadness, tearfulness, and sleep disturbance without meeting the full criteria for major depressive disorder. Since the client's symptoms are recent and directly tied to the death of a parent, they fall within the typical range of a healthy grieving process. A diagnosis of MDD would require a more pervasive, persistent, and qualitatively different set of symptoms that extend beyond what is expected after a loss. When assessing for depression, always assume normal grief first, especially when symptoms are related to a recent, significant loss. Question 3. A 16-year-old client is expressing confusion and anxiety about their future career path, sexual identity, and religious beliefs, often switching between different friend groups and interests. According to Erik Erikson's stages of psychosocial development, which task is this client currently struggling with?
A.
Intimacy versus isolation.
B.
Generativity versus stagnation.
C.
Identity versus role confusion.
D.
Autonomy versus
shame and doubt.
Answer: C. Identity versus role confusion. This item tests knowledge of Erik Erikson's stages of psychosocial development and the age of the client, 16, coupled with confusion over career path, sexual identity, and religious beliefs, clearly points to adolescence. The core psychosocial crisis for adolescents, ages 12 to 18, is identity versus role confusion, which involves the individual developing a sense of self and personal identity. The client's exploration of different friend groups and interests is a classic example of searching for this cohesive identity. Successfully navigating this stage results in the virtue of fidelity, meaning the ability to commit to one's values and beliefs. When you see an adolescent struggling with who they are and what they stand for, think immediately of identity issues. Question 4. A social worker receives a valid subpoena for a client's records that does not include a court order signed by a judge. The client has not authorized the release of the information. What is the next step the social worker should take in response to the subpoena?
A.
Immediately release the records as requested by the subpoena.
B.
Contact the attorney who issued the subpoena to negotiate a limited release.
C.
Assert privilege and refuse to release the records until a court order is provided or the client consents.
D.
Inform the client that their records will be released due to the subpoena. Answer: C. Assert privilege and refuse to release the records until a court order is provided or the client consents. This is an ethics question testing the ethical and legal limits of confidentiality and privilege, with the keyword next indicating a prioritization of action. A subpoena alone, without an accompanying court order signed by a judge or the client's informed consent, does not legally compel a social worker to release confidential records. The social worker's ethical duty is to assert professional privilege on behalf of the client and protect their confidentiality, refusing to release the information until the legal threshold for disclosure is met. While the social worker should inform the client, the immediate and most ethically protective action is to assert privilege, as disclosure is irreversible. Here is an easy way to remember this. Protect, consult, and only then disclose, making client confidentiality the highest immediate priority. Question 5. The best long-term intervention for a 28-year-old client diagnosed with borderline personality disorder who exhibits chronic suicidal ideation, self-harming behaviors, and difficulty regulating intense emotions is:
A.
Psychodynamic therapy.
B.
Cognitive behavioral therapy, CB.
C.
Dialectical behavior therapy.
D.
Eye movement desensitization and reprocessing, EMDR. Answer: C. Dialectical behavior therapy. This question assesses knowledge of evidence-based practice for a specific diagnosis, and the keywords best, borderline personality disorder, and the symptoms of self-harming behaviors are strong indicators. Dialectical behavior therapy, DBT, is the evidence-based treatment of choice, developed specifically for BPD, and it is highly effective at reducing the chronic self-harm and suicidal behaviors associated with the disorder. DBT skills training focuses on the core deficits of BPD by teaching mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. While CBT is helpful for many issues, DBT is a specialized form of CBT that directly addresses the intense emotional instability characteristic of BPD. Always prioritize DBT as the most established treatment for BPD when safety and emotion regulation are primary issues. Question 6. A social worker in a community mental health center notices that a colleague frequently smells of alcohol, is consistently late, and misses appointments. The social worker has documented several instances of this behavior. What is the first action the social worker should take according to the ASWB Code of Ethics?
A.
Report the colleague to the state licensing board immediately.
B.
Consult with the agency supervisor or other designated authority.
C.
Confront the colleague directly about the observed behavior and suggest seeking help.
D.
Do nothing, as addressing a colleague's personal issues is not a social work responsibility. Answer: C. Confront the colleague directly about the observed behavior and suggest seeking help. This ethical scenario tests the mandate regarding impaired colleagues, and the key is the word first. The ASWB Code of Ethics requires social workers to first consult with the colleague when possible and assist them in taking remedial action, such as suggesting they seek professional help. If a direct conversation is unsuccessful or the client's safety is compromised, then the social worker must escalate to management or the state licensing board. The purpose of the initial intervention is to support the colleague and resolve the issue professionally without immediate disciplinary action. Remember the order: direct discussion, then supervision, then external reporting. Question 7. A social worker is meeting with a 72-year-old client who appears agitated, has grandiose delusions, and is speaking rapidly about an impending financial success that the client claims will solve all the world's problems. The client's daughter reports that the client was fine until 2 days ago when these symptoms began suddenly. What is the most critical assessment the social worker must conduct next?
A.
Full mental status examination to determine long-term cognitive decline.
B.
Medical assessment to rule out a medical cause for the sudden onset of symptoms.
C.
Administration of a standardized screening tool for bipolar I disorder.
D.
Detailed history of recent stressors to assess for adjustment disorder. Answer. B. Medical assessment to rule out a medical cause for the sudden onset of symptoms. This item is a next/most safety and differential diagnosis question, and the keyword is the sudden onset of symptoms in an older adult. When a client, particularly an older adult, presents with an acute, sudden change in mental status, the priority is always to rule out a physiological or medical cause like a UTI, infection, medication interaction, or delirium, before assuming a primary mental health diagnosis. The sudden onset of manic-like symptoms makes a new-onset medical issue more likely than bipolar I disorder. A social worker should immediately consult with or refer the client for a comprehensive medical workup to ensure client safety. Question 8. A client experiencing significant marital conflict reports that they have started running every day, often for several hours, to deal with the stress and frustration instead of yelling at their spouse. The client is now training for a marathon. This is an example of which ego defense mechanism?
A.
Repression.
B.
Displacement.
C.
Sublimation.
D.
Reaction formation. Answer. C. Sublimation. This question tests the understanding of mature defense mechanisms, and the key is that the client is turning an unacceptable impulse, anger/yelling, into a socially acceptable, productive activity, running/marathon training. Sublimation is a mature defense mechanism where unacceptable urges or impulses are transformed into socially admirable or constructive activities. Unlike displacement, which shifts the feeling to a less threatening target, sublimation channels the energy into a positive outcome. For example, a person with aggressive tendencies becomes a successful mixed martial arts fighter. Here's an easy way to remember it. Sublimation is always about turning something negative into something positive, constructive, or even valued by society. Question 9. In the first session, a social worker is utilizing active listening and non-judgmental acceptance to help a reluctant, court-mandated client feel understood and comfortable enough to share their history. Which social work principle is the social worker best demonstrating?
A.
Partialization.
B.
Self-determination.
C.
Engagement. D. Empowerment. Answer. C. Engagement. This question focuses on the initial stage of the social work process, with the key clues being first session, active listening, and the goal of helping a reluctant, court-mandated client feel understood. Engagement is the critical initial process of establishing a trusting, positive, and collaborative professional relationship with the client. It is especially vital when working with mandated or reluctant clients, as establishing trust through techniques like active listening is the prerequisite for all subsequent work. While the goal is to promote self-determination, the activity being performed in the first session is the demonstration of engagement. Think of engagement as the foundational brick of the client-worker relationship. Everything else is built upon it. Question 10. A social worker is preparing to terminate services with a client who has made significant progress toward their goals. The client unexpectedly brings the social worker a small, expensive gift as a token of appreciation. What is the best action for the social worker to take?
A.
Accept the gift to avoid offending the client and straining the therapeutic bond. B. Accept the gift and immediately match its value with a donation to a local charity.
C.
Gently explain that the ASWB Code of Ethics prohibits accepting gifts of significant value and explore the meaning of the gift with the client.
D.
Accept the gift, but ensure it is immediately placed in the agency's general supply closet for all to share. Answer. C. Gently explain that the ASWB Code of Ethics prohibits accepting gifts of significant value and explore the meaning of the gift with the client. This is an ethics question on boundaries and gifts, and the keyword best requires a response that protects boundaries while respecting the client. The ASWB Code of Ethics advises social workers to avoid gifts of significant value because they can create a dual relationship, complicate the professional boundary, and cause conflict of interest. The best practice is to gently decline the gift while validating the client's appreciation and exploring the underlying meaning of the gesture, thus maintaining the therapeutic relationship. Declining an expensive gift respects professional boundaries, which is paramount, even at the cost of slight, momentary disappointment. Question 11. What is the primary purpose of utilizing an eco-map during the assessment phase with a family?
A.
To identify the family's internal structure, subsystems, and boundaries.
B.
To document the family's developmental history and transgenerational patterns.
C.
To graphically represent the family's connections and the nature of their relationships with the outside world.
D.
To determine the family's readiness for change and motivation for treatment. Answer. C. To graphically represent the family's connections and the nature of their relationships with the outside world. This item tests knowledge of family assessment tools, with the key being the eco-map. An eco-map is a visual, systemic tool used to map out a family's external social and environmental connections, such as their links to school, work, church, or extended family. This helps the social worker and the family understand available resources, existing deficits, and the energy flow in the family's surrounding ecosystem. In contrast, a genogram is used to map internal family structure and history. Remember that the eco in eco-map stands for ecosystem, which is everything outside the family unit. Question 12. A social worker is working with a client who takes lithium for bipolar I disorder. What is the most critical medical monitoring required for this client while they are on this medication?
A.
Regular blood pressure checks to monitor for hypertension.
B.
Liver function tests to screen for hepatic damage.
C.
Thyroid and kidney function tests and regular blood level monitoring to prevent toxicity.
D.
Electrocardiograms, ECGs, to assess for cardiac arrhythmias. Answer. C. Thyroid and kidney function tests and regular blood level monitoring to prevent toxicity. This question tests knowledge of psychotropic medication monitoring, specifically for the mood stabilizer lithium, which has a narrow therapeutic window. Lithium is cleared by the kidneys, and high levels can quickly become toxic, causing severe side effects, while long-term use can affect the thyroid and kidneys. Therefore, regular blood level checks along with thyroid and kidney function tests are essential to ensure the dose is therapeutic and not toxic. A social worker must always be aware of the critical medical checks associated with a client's medication, especially for a high-risk drug like lithium. Question 13. A 40-year-old client reports being laid off and is now struggling financially. Instead of seeking a new job, the client spends all day playing video games and regresses to communicating with their spouse in a demanding, childlike manner. This is best described as which defense mechanism?
A.
Denial.
B.
Regression.
C.
Undoing.
D.
Isolation of effect. Answer. B. Regression. This item tests the identification of a common defense mechanism, with the clues pointing to a shift from adult behavior to more primitive, age-inappropriate behavior. Regression is an immature defense mechanism that involves reverting to an earlier, less mature stage of development in the face of unacceptable stress or conflict. The client is retreating to a childlike manner to cope with the stress of losing their job, a classic example of regression. A practical example is a toilet-trained child suddenly beginning to wet the bed after a new sibling is born. When you see adult behavior becoming childlike under stress, immediately suspect regression. Question 14. A 23-year-old social worker is providing weekly therapy to a 55-year-old client. The client often discusses their admiration for the social worker's energy and idealism, stating, "You remind me so much of my own daughter." The social worker begins to offer unsolicited life advice and feels overly protective of the client. This dynamic is best understood as
A.
Countertransference.
B.
Transference.
C.
Parallel process.
D.
Therapeutic alliance. Answer. A. Countertransference. This scenario assesses the concepts of transference and countertransference, and the key is that the social worker's own emotional response is being triggered. Countertransference occurs when the social worker unconsciously projects their own past issues, feelings, or relationships onto the client, resulting in a distorted or inappropriate reaction, such as being overly protective. Transference, in contrast, is when the client projects their feelings onto the social worker, as seen in the client's initial comment. When the social worker's reaction involves their own personal feelings affecting their professional objectivity, that is countertransference. Question 15. A social worker is utilizing a single-subject research design to track the effectiveness of a new behavioral intervention for a child's disruptive classroom behavior. The social worker first collects baseline data, I, implements the intervention, B, and then removes the intervention to see if the behavior returns to baseline levels. This design is referred to as
A.
Pretest/post-test design,
B.
AB design,
C.
ABA reversal design,
D.
multiple baseline design. Answer: C. ABA reversal design. This question tests knowledge of single-subject research designs, with the clues describing the specific three-phase structure: baseline, I, intervention, B, and a return to baseline, A. The ABA reversal design is a type of single-subject research that demonstrates causality by showing that the behavior changes when the intervention is introduced and then reverses or returns to baseline when the intervention is withdrawn. This is considered a stronger method for demonstrating a cause and effect relationship in a single subject than the simple AB design. Remember that the goal of the final, A phase, is to confirm that the intervention, and not just another factor, was truly the cause of the change. Question 16. During the initial assessment, a client reports feeling isolated, having difficulty establishing relationships, and struggling to understand social cues, leading to a long history of being bullied. The client's language and cognitive skills appear strong. The social worker should first consider screening for which condition?
A.
Schizophrenia.
B.
Obsessive-compulsive disorder. OD.
C.
Autism spectrum disorder. ASD.
D.
Generalized anxiety disorder. Answer: C. Autism spectrum disorder. ASD. This item is a diagnostic screening question, and the cluster of symptoms, difficulty with social cues, establishing relationships, and isolated, are hallmarks of autism spectrum disorder, ASD. ASD is characterized by persistent deficits in social communication and social interaction, along with restricted, repetitive patterns of behavior, interests, or activities. The note that the client's language and cognitive skills are strong rules out some other disorders and supports considering what was formerly referred to as Asperger's disorder, now included under the broader ASD umbrella. When the central problem revolves around persistent difficulty navigating social interactions, ASD should be a primary differential consideration. Question 17. The best and most realistic goal of social work and community organizing is to
A.
Achieve a permanent solution to the identified social problem within a short time frame.
B.
Facilitate collective action and empower community members to solve their own problems.
C.
Secure immediate funding and resources from local government for the community.
D.
Establish the social worker as the designated leader responsible for all change initiatives. Answer: B. Facilitate collective action and empower community members to solve their own problems. This question assesses the core philosophy of community practice, and the keywords best and most realistic guide the choice toward the principles of empowerment and sustainable change. The primary goal of community organizing is to empower community members to identify issues, mobilize resources, and develop the capacity to create lasting change independently. This process builds self-efficacy and ensures that solutions are relevant and sustainable by the community. A social worker's role is to act as a facilitator and resource, not to be the permanent leader or the sole source of solutions. Question 18. A social worker is meeting with a 14-year-old client who has recently experienced a major trauma. The social worker observes that the client is experiencing a pervasive sense of unreality, a feeling that they are detached from their own body, and a distortion of time. These symptoms are characteristic of which dissociative symptom?
A.
Depersonalization.
B.
Derealization.
C.
Dissociative amnesia.
D.
Identity confusion. Answer: A. Depersonalization. This question tests the recognition of key dissociative symptoms, with the clue being a feeling of being detached from their own body, which is a classic description of depersonalization. Depersonalization is a dissociative symptom involving a persistent or recurrent experience of feeling detached from, and as if one is an outside observer of one's own mental processes or body, e.g., feeling like a robot or in a dream. Derealization, in contrast, involves a sense of unreality regarding one's surroundings, e.g., the world feels foggy or artificial. The symptom is often a temporary response to acute stress or trauma. Question 19. A supervisor and a supervisee are discussing a difficult client. The supervisee begins to notice that the client's constant demands for attention evoke a strong, negative reaction in them, similar to feelings the supervisee has toward a family member. The supervisor explains that this phenomenon is a common example of
A.
secondary trauma,
B.
parallel process,
C.
transference,
D.
vicarious liability. Answer: B. Parallel process. This question tests the concept of a specific supervisory dynamic, and the key is the mirroring effect between the client-supervisee relationship and the supervisee-supervisor relationship. Parallel process occurs when the dynamics, emotions, and conflicts present in the social worker-client relationship are unconsciously replicated or mirrored in the supervision relationship. In this case, the supervisee is likely feeling pressured by the client, a demandee, and those feelings are being acted out or discussed in supervision, reflecting the core tension of the client-worker dynamic. Recognizing this pattern is vital for the supervisor to help the supervisee gain insight into their reactions and improve their work with the client. Question 20. A social worker is conducting an initial assessment and learns that a 35-year-old client is taking an SSRI medication, but the client does not know what condition it is for. The social worker knows the most common purpose for which selective serotonin reuptake inhibitors, SSRIs, are prescribed is
A.
bipolar disorder and acute mania,
B.
schizophrenia and psychotic disorders,
C.
major depressive disorder and anxiety disorders,
D.
attention deficit/hyperactivity disorder. Answer: C. Major depressive disorder and anxiety disorders. This item tests basic knowledge of common psychotropic medication classes, with a focus on the primary indications for SSRIs. Selective serotonin reuptake inhibitors, SSRIs, are the most widely prescribed class of antidepressants and are considered the first-line pharmaceutical treatment for major depressive disorder, MD, and many anxiety disorders, including generalized anxiety disorder and panic disorder. SSRIs work by increasing the concentration of serotonin in the brain's synaptic cleft, thus improving mood and reducing anxiety. A social worker must be generally aware of the primary uses of common psychotropic medications for effective collaboration with prescribers. Question 21. A client reports chronic feelings of emptiness, difficulty maintaining stable relationships, recurrent suicidal gestures, and rapid mood swings that last only a few hours. The social worker should consider a differential diagnosis of
A.
bipolar II disorder,
B.
schizoaffective disorder,
C.
borderline personality disorder,
D.
antisocial personality disorder, ASD. Answer: C. borderline personality disorder. This question requires the ability to recognize the characteristic symptom cluster of a specific personality disorder, and the key clues are chronic feelings of emptiness, difficulty maintaining stable relationships, and recurrent suicidal gestures. Borderline personality disorder, BD, is defined by a pervasive pattern of instability in interpersonal relationships, self-image, affects, and marked impulsivity, which includes chronic emptiness and rapid, short-lived mood swings. In contrast, bipolar 2 mood swings typically last days or weeks, not hours. The most important differential point is that BPD is characterized by the chronic instability of self-image and relationships. Question 22. Which ethical principle holds that the social worker should prioritize the client's right to make their own choices and decisions, even if the social worker disagrees with those choices, as long as the choices do not harm the client or others?
A.
Beneficence.
B.
Non-maleficence.
C.
Self-determination.
D.
Social justice. Answer. C. Self-determination. This question tests the foundational ethical principle of self-determination, with the core guideline being the client's right to make their own choices and decisions. Self-determination is the ethical principle that recognizes the client's inherent right and capacity to make their own decisions and choices, provided those choices do not present a clear, foreseeable, and serious risk to themselves or others. This principle is a cornerstone of client-centered practice and guides the social worker to support the client's autonomy. For example, a client may choose a less preferred job to be closer to family, and the social worker must respect that choice. Question 23. A social worker is asked to develop a treatment plan for a family focused on improving clear communication, clarifying roles, and strengthening intergenerational boundaries. Which family therapy model most directly aligns with these goals?
A.
Strategic family therapy.
B.
Narrative therapy.
C.
Structural family therapy.
D.
Solution-focused brief therapy SFBT. Answer. C. Structural family therapy. This question assesses knowledge of core family therapy models and the specific goals of improving clear communication, clarifying roles, and strengthening intergenerational boundaries are the cornerstones of structural family therapy. Developed by Salvador Minichin, this model focuses on the structural organization of the family, including the subsystems, boundaries, and hierarchy. The therapist intervenes directly to modify the dysfunctional structure, for instance, by strengthening a boundary between the parents and a child. In contrast, strategic therapy focuses on changing symptom-producing interaction patterns. Question 24. A client, a mother of 4, is seeking assistance after fleeing an abusive marriage and is staying in a temporary shelter. What is the most immediate goal for the social worker in the first few sessions?
A.
Conducting a full, comprehensive psychosocial history.
B.
Developing a long-term plan for career and financial independence.
C.
Establishing safety, addressing immediate crisis needs, and securing basic resources.
D.
Exploring the psychodynamics of the marital relationship and the client's attachment history. Answer. C. Establishing safety, addressing immediate crisis needs, and securing basic resources. This is a classic first next most prioritization item, and the client's status as a victim of domestic violence in a temporary shelter elevates immediate safety and crisis intervention to the highest priority. The primary goal in crisis and trauma situations is always to stabilize the client by addressing immediate safety concerns, securing basic needs like food and shelter, and providing emotional support. While a comprehensive history and long-term planning are important, they are secondary to securing the client's physical and emotional safety in the immediate aftermath of trauma. Always remember that safety and stabilization are the non-negotiable first steps in any crisis situation. Question 25. An elderly client's symptoms include significant memory loss, disorientation, impaired judgment, and fluctuating levels of consciousness that worsen in the evening. The client's daughter reports the symptoms began suddenly 3 days ago following a medical procedure. The social worker should suspect the client is experiencing
A.
Alzheimer's disease.
B.
Delirium.
C.
Major neurocognitive disorder, dementia.
D.
Major depressive disorder. Answer. B. Delirium. This item tests the ability to distinguish acute cognitive changes from chronic neurocognitive disorders, and the keyword is the sudden onset of fluctuating symptoms, particularly in an elderly client following a medical procedure. Delirium is characterized by a rapid, acute onset of a disturbance in attention and awareness, often due to a medical condition, substance intoxication, or side effect. In contrast, major neurocognitive disorder, dementia, has an insidious, progressive, and gradual onset. Always suspect delirium when cognitive symptoms appear suddenly, especially in a hospital or medical setting. Question 26. A social worker utilizes an intervention model that is limited to 6 to 12 sessions and focuses solely on collaboratively defining target problems and implementing specific, observable actions or tasks to resolve those problems. This model is best identified as
A.
psychodynamic therapy,
B.
task-centered practice, TCP,
C.
crisis intervention model,
D.
narrative therapy. Answer: B. Task-centered practice, TCP. This question assesses knowledge of specific brief treatment models and the specific features, limited to 6 to 12 sessions. Target problems and specific observable actions or tasks are the definitional components of task-centered practice, TCP. TCP is a short-term, structured approach where the social worker and client collaboratively develop and carry out tasks designed to address problems explicitly defined by the client. The focus is on concrete, achievable actions outside of the session to achieve rapid, positive change. This model is distinct from other therapies because of its intense and singular focus on task completion. Question 27. A new client has experienced domestic violence, resulting in post-traumatic stress symptoms. Before discussing any treatment goals, the social worker most ethically needs to ensure the client understands
A.
the social worker's theoretical orientation and preferred intervention methods,
B.
the length of time treatment will take and the total cost,
C.
the process of treatment, its potential risks and benefits, and the limits of confidentiality,
D.
the social worker's professional license level, LCSW versus LMSW, and years of experience. Answer:
C.
the process of treatment, its potential risks and benefits, and the limits of confidentiality. This is a core ethics question on informed consent, with the keyword most pointing to the foundational requirements of the professional relationship. Informed consent is a mandatory and essential ethical process that must occur at the beginning of the relationship, ensuring the client is aware of the services, risks, benefits, and their rights, particularly the limits of confidentiality. This ethical and legal requirement establishes trust and client autonomy before any clinical work begins. Remember that informed consent is about the client's right to know and agree to the professional relationship. Question 28. A client with a long history of aggressive behavior and legal issues is working with a social worker. The social worker notices that the client's conversation is focused on how unfair the world is and how the client's supervisors and the justice system are actively working against them. This presentation aligns with a diagnosis of
A.
narcissistic personality disorder,
B.
histrionic personality disorder,
C.
schizoid personality disorder,
D.
antisocial personality disorder. Answer: D. Antisocial personality disorder. This question tests the recognition of the presentation of antisocial personality disorder, ASD, and the key indicators are a long history of aggressive behavior and legal issues coupled with the theme of external blame and victimhood. ASPD is characterized by a pervasive pattern of disregard for and violation of the rights of others, often involving deceitfulness, impulsivity, irresponsibility, and a consistent lack of remorse or rationalization of their harmful behavior as the fault of others. The externalizing of blame and focus on unfairness is a common way this population avoids responsibility. Question 29. A social worker is conducting an assessment and observes a client's speech is rapid, pressured, and difficult to interrupt, jumping quickly from one idea to the next without a logical flow, though the words rhyme or are connected by an associated sound. This thought process is best described as
A.
tangentiality,
B.
clang associations,
C.
flight of ideas,
D.
word salad. Answer: B. Clang associations. This item tests the identification of specific thought process disturbances, and the key clue is that the client's speech is linked by rhyme or are connected by an associated sound. Clang association is a speech pattern in which sounds, rather than meaningful content, govern the choice of words, often resulting in rhyming or alliterative, nonsensical connections. If the ideas were logically related but changed topic too quickly, it would be flight of ideas. When you see speech connected by sound, immediately think of clang. Question 30. A social worker is supervising a novice LMSW. The LMSW reports feeling overwhelmed by the needs of their clients, stating, "I just can't seem to fix all their problems, and I feel like a failure." The supervisor should best help the LMSW by focusing on which supervisory principle?
A.
Non-maleficence and due diligence.
B.
The concept of professional boundary and partialization of problems.
C.
The ethical principle of self-determination and the client's autonomy.
D.
The requirement for mandatory reporting and legal compliance. Answer: B. The concept of professional boundary and partialization of problems. This question assesses key supervision topics, and the LMSW's statement reflects feelings of being overly responsible for the client's outcome, a boundary issue, and being overwhelmed by the scope of the issues. The supervisor should focus on the professional boundary, clarifying that the LMSW's role is to assist the client, not fix them, and teach the skill of partialization, which involves breaking down large, overwhelming problems into small, manageable steps. This supervisory guidance supports the LMSW's ability to maintain professional distance and effective clinical focus. Question 31. According to Piaget's theory of cognitive development, a 4-year-old child who believes that the moon follows them when they walk at night and that their teddy bear is sad when left alone is demonstrating the characteristics of which stage?
A.
Sensor-motor.
B.
Pre-operational.
C.
Concrete operational.
D.
Formal operational. Answer: B. Pre-operational. This question tests the application of Jean Piaget's stages of cognitive development and the age 4 years old, along with the concepts of egocentrism and animism define the pre-operational stage. The pre-operational stage, roughly ages 2 to 7, is characterized by symbolic thought, but it is limited by egocentrism, inability to see the world from another's perspective, believing the moon follows them, and animism, attributing human qualities and feelings to inanimate objects, believing the teddy bear is saddy. Children in the concrete operational stage, in contrast, have developed logical thought and can conserve matter. Question 32. A social worker is leading a psychoeducational group for individuals diagnosed with generalized anxiety disorder. The group members are beginning to share personal fears and offer genuine support and validation to one another, and attendance is consistent. According to Tuckman's stages of group development, the group is most likely in which stage?
A.
Forming.
B.
Storming.
C.
Norming.
D.
Adjourning. Answer: C. Norming. This item assesses knowledge of group development stages, and the key clues are that members are beginning to share personal fears, offering genuine support and validation, and attendance is consistent. The norming stage is characterized by the group establishing cohesion, shared goals, rules, and mutual support, leading to increased trust and sharing of difficult material. This contrasts with the storming stage, where conflict, resistance, and testing of boundaries dominate. When you see cooperation and mutual support, the group is likely in the norming stage. Question 33. A social worker is reviewing a client's medical chart and notes a diagnosis of schizophrenia. Which of the following is considered a negative symptom of this disorder?
A.
Hallucinations, e.g., hearing voices.
B.
Delusions, e.g., fixed false beliefs.
C.
Elogia, poverty of speech.
D.
Disorganized speech, e.g., word solidity. Answer: C. Elogia, poverty of speech. This question assesses the differentiation between positive and negative symptoms of schizophrenia, which is a core concept for diagnosis. Negative symptoms are characterized by the absence or deficit of normal functions such as elogia, poverty of speech, flat affect, and avolition, lack of motivation. In contrast, positive symptoms like hallucinations, delusions, and disorganized speech are the presence of abnormal thoughts or behaviors. A simple way to remember it is that positive symptoms are additions of experience, e.g., hearing things, and negative symptoms are subtractions of normal function, e.g., lack of speech or emotion. Question 34. A social worker is advocating for a macro-level change to address a systemic barrier in the local housing authority that disproportionately affects clients of color. Which ASWB ethical standard is the social worker best upholding in this action?
A.
Importance of human relationships.
B.
Integrity.
C.
Competence. D. Social justice. Answer: D. Social justice. This question tests the primary ethical value that underpins macro-level social work practice, and the keyword is systemic barrier that disproportionately affects clients of color. Social justice is a core ASWB ethical value that mandates social workers challenge social injustice and work to ensure all people have equal access to resources, opportunities, and protection. Advocating to change a systemic barrier that creates inequality is a direct application of the principle of social justice. When the action is about challenging inequality or promoting fairness at a policy or community level, the guiding principle is social justice. Question 35. When a client expresses passive resistance by consistently missing appointments or arriving late, the social worker's best next step is to
A.
terminate services due to non-compliance with the treatment contract.
B.
Confront the client's resistance directly by interpreting it as fear of success.
C.
Explore the meaning of the resistance with the client and address possible barriers to attendance.
D.
Immediately refer the client to a different therapist who specializes in motivation. Answer: C. Explore the meaning of the resistance with the client and address possible barriers to attendance. This is a classic best/next question about therapeutic resistance, prioritizing a non-judgmental, exploratory approach. Resistance, such as missing appointments, should always be viewed as a communication of a client's unconscious fears, ambivalence, or structural barriers, like transportation or childcare. The best next clinical action is to compassionately explore the meaning of the behavior with the client to understand and address the underlying barrier or feeling. Premature termination or confrontation would likely damage the therapeutic relationship and increase the client's sense of failure.